A farm worker in Michigan has been diagnosed with bird flu. It is the second human case linked to an outbreak in U.S. dairy cows. Health officials say the Michigan patient had mild symptoms after coming in contact with infected livestock. So how concerned should we be? Joining us to talk about this in our health headlines, he is Dr. Bill Hartman, the clinical trialist at UW Health. Doctor, great to see you. All right, what should we know about this latest news?
Well, this is actually the second human case that we've heard about this week. Another case in a child in Australia has also been confirmed with H5N1. The case in Michigan is another farm worker who was exposed to an infected cow in an infected herd there in Michigan. It's interesting to note that the infection did not get picked up on a nasal swab. That came back negative. But the culture of the fluid that was draining from the eye confirmed the H5N1 diagnosis. He has fully recovered. I don't think that we should be overly concerned or alarmist at this point. We have to keep an eye on things, make sure that this doesn't evolve beyond what it's doing. But certainly something that we are all just kind of turning our attention to.
Yeah, the first case was in Texas. This is a lot closer, and we got a lot of dairy workers here. So the risk, in your assessment, still very low? They're saying this was isolated, right? This person didn't spread it to anybody else.
Right, and we have not seen any human-to-human spread of H5N1 at this point. And so I do think that the risk is very low. It's clearly higher for dairy workers, and they should be protecting themselves as they're cleaning out the stalls while they're interacting with the cattle, using eye protection and other PPE forms if they have it available. But protection of the dairy workers right now, I think, is first and foremost what we should be focusing on.
Yeah, they should be reporting symptoms, even if they're like a nothing burger. They got to let somebody know about that. All right, we had some surprising news about marijuana. The number of people who now use marijuana daily, according to this new study, outnumbers the number of people who use alcohol daily. That's a big shift.
It is a big shift, and it's 30 years in the making. Certainly, alcohol is used more often, but in the people that are using marijuana daily, they now are using it more than people who use alcohol daily. In fact, they've said that 40% of people who admit to using marijuana are using it daily. And so that's a very, very high number. One of the things that we have to be concerned about is that the daily use of marijuana, these frequent users of marijuana, are clearly at risk of becoming highly addicted to it.
And I saw it increases the risk of cannabis-associated psychosis. What is that?
Cannabis-associated psychosis is also can be a form of this cannabis poisoning that people can get, where it induces hallucinations, confusion, symptoms such as that, that oftentimes can make the person have to be admitted to the hospital until the symptoms clear.
Yeah, and there's been so much talk in our state about legalization, and it's obviously legal at every state around us. So, yeah, we'll keep watching that as well. Dr. Bill Hartman, appreciate your time today.
Thank you.